Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing cold sores. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started, guys. So what is a cold sore? So it's often called a cold sore or sometimes called a fever blister. And it is from a viral infection. So they are tiny fluid-filled blisters that form around your lips, normally in the same location. So they will come back multiple times once you have them. So these blisters are often grouped together in a patch. And once they break, they form a scab, and it does take several days to heal. From the time a cold sore starts, to the time it is gone, it's normally about a 2 to 3 week process. So cold sores can spread from person to person through close contact, such as kissing. Okay, so they're usually caused by the herpes simplex virus 1. Less common, the herpes simplex virus type 2, and they can affect the mouth and genital area, and they can spread. Okay, if you have a cold sore, they can spread in these areas. Okay, so be very, very cautious, because they can spread person to person. All right. So there is no cure for cold sores, but treatments can help manage outbreaks. So antiviral pills or creams can help heal the sores quicker, and they may reduce the frequency. Okay. So symptoms usually pass through several stages. Okay, so everybody goes through these. They'll start with a tingling and itching sensation that appears where the actual blisters are going to erupt. Okay, so they'll have that for a few days or so before the actual blisters appear. Then the blisters come. So it's a small fluid-filled blisters, and they typically erupt borderline of your lips. Sometimes they can appear through your nose, cheeks, or inside the mouth. More commonly, children will experience it inside the mouth, and they're often mistaken for canker sores. Okay. So once the blisters come, then they will eventually erupt and ooze and crust over. Okay, the small blisters will leave shallow openings, sores, and the ooze crust over. Then they start to heal at that point. Now, signs and symptoms vary depending on if it's your first outbreak or if it's reoccurrence, because cold sores do continuously reoccur, normally in the same location every time. Okay, so they can last several days, and the blisters can take up 2 to 3 weeks to completely heal. Reoccurrence normally happens in the same location. Okay, it's normally not as severe as the first outbreak. So the first time you have an outbreak, you might experience fever, painful gums, sore throat, headache, muscle aches, swollen lymph nodes, and once again, children under 5 often experience it on the inside of their mouth. Okay, and it's often mistaken for a cold sore. So often cold sores, they generally clear up without treatment. Okay, but you do want to see your doctor for this if you have a weakened immune system, if your cold sores aren't healing within 2 weeks time, if your symptoms are severe, if you're having frequent reoccurrence of cold sores, or if you're experiencing irritation to your eyes. So the causes. So as I said before, it is caused by the herpes virus 1. So herpes simplex virus 1 is what usually causes the cold sores. Okay. Herpes virus 2 is usually responsible for genital herpes. Now, once again, this can spread. Okay, so it can go from the lips to the genitals. Okay, if in close contact. So shared eating utensils, razors, towels can spread the virus. Cold sores are most contagious when they're oozing blisters, but it can spread the whole time that you have the cold sore, okay? Even when you don't have the blisters. So right before, when you have that tingling sensation, it can be spread. So a lot of people are infected with this and don't even show signs and symptoms of infection. But once you've had an episode, okay, of herpes infection, the virus does lie dormant inside of your nerve cells, and then may be triggered by one of the following. So a viral infection or fever, hormonal changes, stress, fatigue, exposure to sunlight and wind, changes in your immune system, and any injury to the skin. Okay, so those can trigger a cold sore flare up. So risk factors, pretty much everybody is at risk for this. Most adults do carry the virus that causes cold sores, okay? It's just laying dormant. And a lot of us have never had any symptoms. Once you've had symptoms of this, it's more likely to reoccur. So you're most at risk for complications if you have a weakened immune system, okay? So conditions such as HIV or AIDS, eczema, if you're taking chemotherapy or anti-rejection drugs, okay? This puts you at higher risk. So what are the complications from cold sores? So they can spread to other areas of the body, okay? And in some cases, it can be a medical emergency. So the first complication I'm going to discuss is children and their fingertips. So if you have a child who likes to suck on their thumbs, it can transfer to their thumb, okay, directly from their mouth. Eyes. So sometimes the virus, it can cause eye infections. So repeated infections can sometimes cause scarring, injuring your eye, leading to vision problems in the long term, okay? And then we have widespread area of skin. So if you have eczema and have cold sores, it can spread throughout the whole body, so across the whole body, and this can become a medical emergency. So prevention. So your doctor can prescribe antiviral medications if you're experiencing a lot of reoccurrence, okay? So they like to say about 9 times a year. If you're experiencing this, your doctor may prescribe an antiviral medication for you to take on a regular basis. Now, if it's, say, the sun, that's every time you go out in the sun, you tend to get a cold sore, use sunblock in that area, in that specific area, okay? Also, if there's other activities that are triggering the condition, just talk to your doctor and they may decide that an antiviral medication is for you. And then just to help avoid spreading cold sores to other people and other body parts. So you're going to avoid kissing and having contact with people when you're in an outbreak, okay, or when you have the sensation that one is going to come. Avoid sharing utensils, towels, lip balm, other personal products that could spread the virus. And then just keep your hands clean, especially when you have the cold sore. And then just be super careful when touching others, especially babies. So your doctor can usually diagnose a cold sore just by looking at them, but sometimes they do take some fluid or a sample from the blister to test for in the laboratory. So treatments. So they're not, cold sores are generally cleared up without treatment within 2 to 4 weeks, but there are several types of antiviral medications to speed up the healing process. They can come in pill form. They generally work a lot better than the creams. Just depends on what your doctor thinks and is most appropriate for you. For very severe infections, antiviral drugs can be given through an injection. So lifestyle and home remedies. So there are lots of over-the-counter cold sore ointments. One such as Abreva. It may shorten the healing time. So you want to start this at first symptom. Okay, when you start having that tingling, you want to start applying it. Now you're going to apply it to a cotton tip applicator and then apply it. Okay, so then this helps prevent the spread to other parts of the body. Okay, because if it starts touching over this way, or if it's touching up here when you close your lips, whatever it might be, it does help prevent. Okay. And then just to ease discomfort of a cold sore, try other cold sore remedies, okay, such as drying agents. So alcohol can help speed the healing time, so you're drying it out. Using lip balms and creams to protect your lips from the sun. Apply a cold compress. It can help reduce redness, crusting. It can really help. A warm compress can help with pain, or you can try taking over-the-counter pain relief medications, okay? There are some creams with lidocaine in them. This will also provide pain relief. So that's all I have for this video, guys. I hope it did give you a better understanding of cold sores, and that they are very contagious, and how we go about treating them. But that's all I have for this video, guys. I hope to see you in my next one. Bye for now.